We are asked numerous times, how do I know I have adhesions? And there is no x-ray, there is no test, there is no CAT scan, there is no ultrasound that shows adhesions. But there are some tests that indicate that there are adhesions, such as in blocked fallopian tubes or a small bowel obstruction. So a test for blocked fallopian tubes, one of them is a firm view. And the firm view is when a doctor places a catheter into the uterus through the cervix and injects a saline with some air bubbles in it. And these air bubbles, if the tubes are open, air bubbles go up through the uterus and they kind of dissipate through the fallopian tubes. And you're watching this via ultrasound. It's actually a really, really neat test to watch. If the doctor places the saline with air into the uterus and these little air bubbles just kind of migrate into the uterus and they don't dissipate out, that's an indication that the fallopian tube is blocked. Another test for a fallopian tube blockage is an HSG, which is what we have here. So this is a picture of the HSG. And on this one here, you could see where the uterus is tiny, or not very wide, and there is nothing coming out of the uterus. But the uterus already has that contrast in it, and you can see this little line coming up to the uterus. That is the line that's putting the contrast in. And after clear passage, there's another HSG, and you can see where the uterus is actually wider, and then there is spillage, all that white stuff, that's contrast. That's dye that was inserted into the uterus, and that contrast is coming out. So that is an HSG. When we start looking at bowel obstructions, there are quite a few tests we can do also. On children, they actually do abdominal ultrasounds to see if there's a bowel obstruction. Another test is a CAT scan, and you can see a bowel obstruction with a CAT scan, especially with these dilated loops, and that's an indication there's an adhesion. And there's another test called a barium swallow or a bowel follow-through, a small bowel follow-through, and that's here. So a small bowel follow-through is when you drink barium and then they start doing x-rays or fluoroscopy to see that barium move through your bowels. And in a barium swallow or a small bowel follow-through, they follow the intestines and they follow this barium all the way through. And then look here, this is actually a stricture. This is not a obstruction, but they see a stricture, which in this case looks like a little piece of yarn. But I'll show you here, you can actually see these intestines. This is after our treatment, and what you've seen is that we've actually cleared up this stricture. But what you could also see is how that barium has moved through, and it just lights up your intestines so the doctors can see that on the x-ray.